Good morning, and on behalf of Screen NJ and Rutgers Cancer Institute, hello and welcome to Community Cares and Project Echo. Thank you so much for joining today's session, and we hope that the information shared today will help you serve your community better. And I have a few announcements before we begin. Right. So this is just a quick disclaimer that the information contained in this presentation is not substitute for medical consultation, and a physician should always be consulted for any health problem or medical condition. And this is what we're going to be doing today. This is today's agenda. We're going to do a Project Echo series overview, introductions, the actual presentation, a case study, and we'll do questions at the end. And a little bit about Project Echo. So the Rutgers Cancer Institute became a Project Echo hub in 2021, and Project Echo is a movement to demonopolize knowledge and amplify local capacity to provide best practice care for underserved people all over the world. The Echo model is committed to addressing the needs of the most vulnerable populations by equipping communities with the right knowledge at the right place at the right time. So this is done by using technology to leverage scarce resources, sharing best practices to reduce disparities, and applying case-based learning to master complexity. If you want more information, visit echo.unm.edu. All right, and then we have our introductions. We have our speakers today. So Ryan will be doing the didactic portion, and Ryan Moulton is a community cancer control specialist slash health educator for the community outreach and engagement team at Rutgers Cancer Institute, Cancer Health Equity Center of Excellence. He's been working for Rutgers Cancer Institute since April 2022. Ryan's focus areas within the team includes prostate cancer, genetics, familial risk, clinical trials, and the research process. Ryan also works very closely with our network of community members, leading and facilitating internal programs to bridge the gap between research and the community. Then we have Ralph, who will be doing our case study. Ralph Stowe is the founder of Jazz for Prostate Cancer Awareness, a nonprofit that harnesses the power of live jazz to promote men's wellness and support free cancer screenings. The organization was born from Ralph's personal experience and deep love for his late brother, legendary jazz trombonist James Jimmy Stowe, who passed away from prostate cancer at the age of 61. During James's treatment, he urged Ralph and the brothers to get screens, ultimately leading to early diagnosis and successful treatments for all three. And encouraged by his urologist, Dr. Isaac Kim, and moved by the jazz community's admiration for his brother, Ralph became a passionate advocate for education and early detection. Today, Jazz for PCA partners with musicians, venues, healthcare professionals, and community organizations to raise awareness and honor James's legacy through music and outreach. Okay, and we'll begin with Ryan.
Thank you for the introduction, Sarah. It's nice to be here today, guys. Thank you all for joining. As Sarah mentioned, my name is Ryan Moulton. I'm a community cancer control specialist with the Community Outreach and Engagement team here in New Brunswick, New Jersey. So today I'm going to be giving an overview of prostate health and cancer prevention. Our main goal for this workshop today is to give everyone an idea of what prostate cancer is, give you guys the basics as to how it's detected in men, and inform you on the benefits of prostate cancer screening. And so we're also going to be discussing things like the signs and symptoms of prostate cancer and looking at treatment options for prostate cancer. You could advance. All right, so we have a pre-test for you guys. As always, we like to test your existing knowledge on what topics we're doing for the day, see what you already know about that topic. So we have a pre-test. It's just meant to serve as a self-evaluation on what you already know regarding prostate cancer. So if you guys want to take a moment to answer the three pre-test questions, they should be up on your screen now. And at the end of the presentation, we will go over the answers again. We'll have you all answer these questions one more time just to test what you've learned from the presentation, see if any of your answers changed, and then we'll go over the answers. So I'll give you guys a couple of seconds to get those in, and then we will move on to the good stuff. All right, hopefully you guys had some time to get those answers in. Like I mentioned, we'll be going over those at the end of the presentation. So now I want to get into what prostate cancer is. So prostate cancer is defined as a disease in which you have these cancerous or malignant cells that form in the tissue of the prostate. And if you're not familiar, the prostate is a gland in the reproductive system that makes part of the fluid in semen, and it's located just below the bladder and in front of the rectum. It's normally only about the size of a walnut, so it's not very big, and it surrounds the urethra. There is some instances where in some men, as they get older, as they start to age, it can become abnormally large and sometimes cause difficulty with things like urination. It can cause problems with sexual function. In this case, this was actually a condition we call benign prostatic hyperplasia, BPH for short. And although this is not cancer in itself, it does sometimes require medications or surgery to treat it. And sometimes the symptoms of BPH can also be similar to the symptoms that men experience when they have prostate cancer. And we'll discuss that a little bit more later on. So looking at the screen now, these figures are basically painting a picture as to how common prostate cancer is compared to other types of cancer. It is actually the second most common non-skin related cancer that's diagnosed in men. We saw an estimated 288,300 new cases of prostate cancer in the United States in 2023. We also know that it is the second leading cause of cancer death in men behind lung and bronchus cancer. And in 2023, I believe we saw an estimated 34,700 deaths from prostate cancer. And it's really not clear as to why this is, but we do know that data from the CDC does suggest that New Jersey has one of the highest incidence rates of prostate cancer in the entire country. It's actually the second highest incidence rate with 147.4 new cases per 100,000 men. And the only state with a higher incidence rate for prostate cancer is Connecticut with 149.8 new cases per 100,000 men. And although we do have one of the highest incidence rates of prostate cancer in the country, meaning our state, on the other hand, we actually have one of the lowest mortality rates from prostate cancer in the country. We see about 16.2 deaths per 100,000 men. So that's kind of a testament to the work being done in our state to diagnose prostate cancer, but we're diagnosing it at an early stage. So when doing so, we're catching the disease early and we're able to treat it a lot more effectively than when it's caught late, leading to a low mortality rate from prostate cancer. And the only states that have lower death rates from prostate cancer are New York and Florida. So we're doing a good job at reducing the burden of prostate cancer in our state. This is just looking at some of the risk factors for prostate cancer. We know that about 1 in 8 men will end up developing prostate cancer in their lifetime, and the average age of diagnosis is about 67 years old. So it is one of those, like similar to other cancers, diseases of aging. The older you get, the higher your chance of developing prostate cancer. And although this disease is oftentimes not fatal, we know that most men with prostate cancer, they really don't end up dying from it. We do see about 34,000 deaths per year from prostate cancer in the United States. And there are a couple of different risk factors for prostate cancer that are known. These are similar to risk factors you'd see for other common types of cancers. This would include older age, of course. The older you get, the more likely you are to develop cancer. Also, using tobacco and smoking tobacco, having a family history of prostate cancer. So that would include having any brothers or fathers, grandfathers, uncles that have a history of prostate cancer, and also having a history of specific genetic syndromes, including the BRCA gene mutation. For those that aren't familiar, BRCA is the breast cancer gene. We have BRCA1 and BRCA2, and although those are more commonly associated with an increased risk for breast cancer in women, we also need to remember that it also means men can be more at risk for developing male breast cancer and also prostate cancer with this genetic mutation. All right, now I want to look at the signs and symptoms of prostate cancer. And it's tricky because early stage prostate cancer usually doesn't cause any symptoms. And so in most cases, we are identifying these prostate cancers through screening. oftentimes when people don't have symptoms. So most of these problems that you guys are seeing up on your screen are more likely to be caused by something other than prostate cancer. But nonetheless, it's always important that you or a loved one talks to a healthcare provider if you have any of these symptoms so that they can do the proper screening exams or tests to figure out what the cause is. But when we have prostate cancer that starts to get more far advanced, this is where you start to see those symptoms appear. And these can be things like problems with urination. So, for example, having a slow or a weak urinary stream, urinating frequently, especially at night, feeling any burning or painful sensations while urinating or ejaculating, and then having any difficulty stopping or starting urination. These can all be symptoms of prostate cancer. When we look further into far advanced prostate cancer, people can also experience blood in their urine or in their semen, or they can get the sudden onset of erectile dysfunction. And if you're not familiar, that's just when men cannot get or maintain an erection. And I'll reiterate, that displaying one or more of these symptoms is not going to ever guarantee that someone has prostate cancer. But if someone does have symptoms similar to these, they should always, be on the lookout and alert their doctor as soon as possible. And so, when we again have very far advanced prostate cancer that is actually potentially spread to other parts of the body, we call that metastasized to other parts of the body. You can get these other symptoms that could be indicative of the cancer spreading to other parts of the body. So this can include pain in different parts of the body, like the spine, the hips, the chest. All of this could mean that the cancer has started spreading to the bones. They may also experience weakness or numbness in their legs or in their feet, or experience a loss of bladder or bowel control, which again could be a sign that the cancer started to spread to other parts of the body that would lead to these symptoms. So, again, if you or someone you know has any concerns about these symptoms and whether or not it could be prostate cancer, it's always important to consult your doctor as soon as possible. And so that's when you would recommend cancer screenings and prostate cancer screening. So, screening in general is when we're looking for cancer before a person has any symptoms, meaning prostate cancer screening is looking for the presence of prostate cancer, specifically cancer in the tissue of the prostate before or after symptoms have appeared. And as we know, this has been a common theme throughout our Echo series. Screening is super important for identifying cancers at an early stage. And oftentimes you may not have symptoms present yet. So we're detecting cancers before symptoms appear. And when you have these abnormal tissues that are found early, it's possible that it could be easier to treat. And we know that by the time symptoms appear, oftentimes the cancer may have, begun to spread to nearby healthy tissue or to other parts of the body. And that obviously makes it a lot harder to treat and increases the risk for that patient being harmed from the disease. So I do want to note that when it comes to cancer screenings, I do understand how sometimes people are fearful of the outcomes of cancer screenings. And therefore, when they do suggest, when they're at their doctor's office and they're suggested a screening exam, they get nervous about it and they may think that their doctor thinks they have cancer. And so it's important to remember that, when you are at your doctor's office, it's never your doctor's thinking that you have cancer if they suggest a screening test. I like to think of it more as a routine checkup that's super important for your health. So when it comes to the screening exams for prostate cancer, we currently don't have any routine screening standards for prostate
Mm-mm,
cancer, but the two most common
mm-mm,
methods
mm-mm.
of prostate cancer screening that are used in practice are the digital rectal exam and the prostate specific antigen test, the PSA test for short. We're going to discuss PSA a little bit further in the next slide, but I do like to introduce the concept that for a typical man, with PSA testing, you're measuring the amount of PSA in the man's blood, and the normal value for PSA in the blood is less than 4.0 nanograms per milliliter. So having anything higher than that, high levels of PSA in the blood greater than that 4.0 threshold could indicate the presence of prostate cancer. And I say could and not does because there are a couple other things that can cause PSA levels to rise, which we'll look at later on. However, there are instances where prostate cancer could be present even if PSA levels are considered normal, so less than 4.0 nanograms per milliliter, which is why we also use the digital rectal exam. The digital rectal exam, the DRE, is an exam of the rectum, and that's where doctors will insert a lubricated gloved finger into the lower part of the rectum to actually feel the prostate for any lumps, any abnormalities, anything that could seem unusual on the surface of the prostate. And this is typically done in your doctor's office. And I understand it's, sometimes uncomfortable for some men, but it's typically a very quick and painless procedure that's getting done, less than 5 minutes and you're good to go. All right, so PSA, again, PSA stands for prostate specific antigen. It's a molecule that's produced by the prostate and essentially is just there to help the prostate perform its job. Again, we check PSA levels by doing a simple blood test, typically in a doctor's office, in a laboratory. And like I mentioned in the previous slide, normally the amount of PSA in a man's blood is low, but there are things that can make PSA levels rise. Apart from prostate cancer, you can have enlarged prostates similar to BPH, that benign prostatic hyperplasia, that can cause PSA levels to rise. There are certain infections that can cause those PSA levels to go up, inflammation, trauma, and of course, prostate cancer. And like I mentioned, having elevated levels of PSA is not going to guarantee someone has prostate cancer. In some men, like I mentioned in the first slide, as they get older, they their prostate can just simply become abnormally large. It can become inflamed. It can cause problems with urination, problems with sexual function. This is where we have that benign prostatic hyperplasia. And again, like I said, sometimes the symptoms of BPH can mimic the symptoms of prostate cancer. And so we basically recommend that if you do experience symptoms that could go either way, it's always important to go and get those proper screening exams done. So looking at this slide, we can see from these two graphs up on the screen how prostate cancer screening has actually significantly reduced the rate of advanced prostate cancer. Figure B on the top is you can see there is a steady decline in prostate cancer diagnosis at all stages since around the year 2008. And then if you look at the second graph, figure C on the bottom, you can actually see a very sharp decline in the incidence rate for advanced prostate cancer around the year 1990. And so this was likely due to just the simple fact that more men were getting screened. And this leads to us catching the disease at an earlier stage and thus preventing the progression to a late stage. We do, however, see that the incidence rate of advanced late stage prostate cancer is actually it started slightly going up around the year 2010. And this is just likely due to the fact that less of these men are undergoing screening. And so, again, that just kind of shows how important early detection is for the prevention of late stage diagnosis. And when we break the incidence and mortality rates of prostate cancer down by race and ethnicity, we actually see that there are certain populations that do experience prostate cancer at disproportionate rates when you compare them to non-Hispanic whites. So, for example, we know African American men are about 1.7 times more likely to be diagnosed with prostate cancer and about 2.1 times more likely to die from the disease compared to white men, which is why we really strongly encourage early detection in these communities, as there's, clearly a disproportionate, they're clearly disproportionately affected by this disease. And so, although there really isn't no definitive reason as to why these differences exist, we do know that there are a couple different factors to consider that can impact cancer risk and outcomes in the African American population. We know that socioeconomic status is correlated with an increased cancer risk. And in the United States, we do see a correlation with socioeconomic status and race. And then there are other social determinants of health, things like diet, exercise, lack of a built physical environment. All of these things kind of play a role in increasing that risk. And they're also correlated with that socioeconomic status. And then there's just the fact that there are also racial biases that exist in preventative care. We actually know from research that Black men are less likely than white men to actually be offered PSA testing. And then, according to the National Cancer Institute Surveillance, Epidemiology, and End Results Program, so their SEER program, we know that non-Hispanic Black men experience a rate of 176.2 new prostate cancer cases per 100,000 Black men. When you look at the white non-Hispanic rate, we see about 103.5 new diagnoses per 100,000 men. So what does that mean? That basically is saying that Black men are experiencing significantly higher rates of new prostate cancer diagnoses despite having significantly less cases of the disease. So their rate is higher, but they're not having as many being diagnosed. So there, that in itself tells us that there is a disparity that exists. And then we're also seeing the rate of advanced prostate cancer in Hispanic Latino men go up, again, likely due to reduced amounts of screening in this population. All right, so let's say, I go to the doctor's office and I have high PSA levels and they found something abnormal in the digital during the digital rectal exam. So what happens if this doctor is detecting elevated PSA levels above that 4.0 or they feel something abnormal during the digital rectal exam? What happens next? So this is where you would have a biopsy. So your doctor's going to recommend some sort of diagnostic test to confirm the presence of prostate cancer. You cannot definitively say it's prostate cancer without undergoing a biopsy. And there are a couple techniques for how this is done. We have standard techniques like a transrectal ultrasound guided prostate biopsy. You have an MRI guided biopsy. And then you also have a transperineal prostate cancer biopsy. I'm not going to go into too much detail about these. These are just the different types of biopsies that a doctor could perform to collect a prostate cancer tissue sample. Generally speaking, a biopsy, this is where your doctor is going in and they're taking a sample from somewhere in the body where a disease may be present, and then they're just taking that sample and they're examining it under a microscope to look for the presence of said disease. So in this case, your doctor's going in, they're going to be taking a tissue sample directly from the prostate, and oftentimes they're going to take multiple tissue samples in multiple locations on the surface of the prostate to make sure they're covering their grounds. And again, they're looking for the presence of prostate cancer and also determining the extent of the disease. So after the biopsy, your doctor is going to take those tissue samples that they collected during the procedure and basically tell you whether or not you're diagnosed with prostate cancer. So your pathologist is going to take those tissue samples, evaluate them under a microscope, and again, confirm if that patient has prostate cancer. What they do is they report, if the pathologist confirms the patient has prostate cancer from this biopsy, they're going to report it as a score. They call this the Gleason score. This is a score from 6 to 10. 10 is considered the most aggressive type of prostate cancer. And you may be wondering how this is calculated. So when it comes to prostate cancers, most of them contain cells that are at what we call different mutation stages. So doctors are going to determine the Gleason score by looking at the two most prevalent patterns of cell abnormalities that are observed in the prostate tissue sample that's collected during the biopsy. So the pathologist is going to give these cell abnormalities, they're going to give them a score from 3 to 5. We call this a Gleason grade. So basically, again, you have all these different cells on the surface of the prostate that are at different mutation stages. We call these their grades. You have grade 1. Grade 1 cells resemble basically normal prostate cells. As you progress up the grade scale, grade 5 is where you're considered, these cell abnormalities are considered high grade, and they've mutated to a point where they're almost unrecognizable from normal prostate tissue cells. So they look very, very different. And so what the doctor does is they add together these two grades from these cell abnormalities to determine the Gleason score. So let's do a scenario, an example. So let's say a pathologist is examining a prostate tissue sample, and they discover that the most prevalent abnormal cell is a grade 4. So about, let's say, 30% of the cell patterns in this tissue sample are grade 4 cells. Doctors looking again, second most prevalent abnormal cell that they see in this tissue sample are grade 5 cells. So they see 28% of the cells are grade 5 cells. So the Gleason score is essentially determined by adding these two grades together. So you're going to add grade 4 plus grade 5 because those are the two most common abnormal cell patterns that they see. And they're going to get a Gleason score of 9. And so the stage of someone's cancer and then what treatment their doctor is going to recommend for them is going to be based on PSA levels, what their Gleason score was, and then any abnormalities that were found during the digital rectal exam. And now I want to look at treatment very briefly. So three main treatment options for prostate cancer are active surveillance, radiation, or surgery. We're going to go over each of these. Obviously, there are a couple of different other ways you can treat, but these are the most common treatments that we see for prostate cancer. So active surveillance essentially means that you're not going to get any treatment for the prostate cancer, but your doctor is going to work with you and watch you very closely to make sure it's not progressing to a more advanced disease. And I know you might be wondering, well, why would someone who is living with cancer, why would they not be treated? Why would you just monitor the progression of the disease? So that's because this type of treatment is typically preferred for men that have very low risk, slow growing prostate cancers. It basically requires those patients to get yearly repeat testing with PSA, with digital rectal exams, with biopsies, just to monitor the progression of the disease. And typically we see this again with men who have very low risk, slow growing prostate cancers that are also very high in age. Sometimes it may take, upwards of 10 years for the disease to progress to something that could be concerning for that individual. And oftentimes there may be instances where someone would be more at risk from treating the disease, being harmed from the treatment options rather than just leaving the low risk cancer in the body. We'll talk about that a little bit more when we look at the screening guidelines. You have radiation therapy. This is commonly used to treat all different types of cancers. It's a good option for patients that want to avoid any pain associated with surgery. We do know that men who are treated with radiation therapy, they can have long-term complications with things like urination. They can experience pain, urinating frequently when they do undergo radiation therapy for their prostate cancer. And then finally, we have surgery. This is considered the gold standard treatment for men with prostate cancer, usually performed using some sort of non-invasive robotic surgery machine. So you're not getting sliced open. And typically patients are going to go home from the hospital on the same day or the next day. Surgical removal of all or part of the prostate gland. We call that a prostatectomy. And although there are associated risks with surgery, usually we see that patients who undergo it do have excellent long-term outcomes and survival. Usually patients can experience some short-term side effects on things like urination and sexual function. And then if the entire prostate is removed, you may no longer be able to ejaculate.
Mhm.
Now I want to talk a little bit about the controversies associated with the PSA test. And they're not necessarily controversies per se, but you remember how I mentioned that there are no routine screening standards for prostate cancer. That's basically because PSA is really not a perfect test for screening. There are, like we looked at earlier, a couple of different other reasons as to why PSA levels can rise in someone besides prostate cancer, rise above that 4.0 threshold. You have benign prostatic hyperplasia, that benign, enlargement of the prostate. You have inflammation, trauma, certain types of infections. All of these things can cause those PSA levels to rise. And unfortunately, this actually leads to instances of false positives. So we have, scenarios in which some men, they go and get their PSA levels checked, they get their results, and their PSA levels are high. So it's indicating or suggesting that they have prostate cancer. This leads to further diagnostic testing being done, like a biopsy, only to discover that they do not have prostate cancer. And then we also know that about 15% of prostate cancers are diagnosed in men that have PSA levels that one would consider normal, less than 4.0 nanograms per milliliter. And so therefore we have instances where men, they go and get their PSA levels checked, suggests they don't have cancer. meaning low PSA levels, only to discover later on that they do in fact have prostate cancer. And so that ends up causing a delay in treatment of the disease. And this is what we'd call a false negative. So those are the kind of quote unquote controversies that are associated with PSA testing, those instances of false positives and false negatives. All right, so given all this information, we want to look at who should be screened for prostate cancer. And every man should at the very least think about whether they should be screened for prostate cancer and also have that conversation with their doctor about whether screening is right for them. So that's where the screening guidelines come in. So typically for men who are under 40 years old, prostate cancer screening is actually not going to be recommended. And that's because it's very rare for a man before the age of 40 to develop prostate cancer. We looked at what the average age of diagnosis was. It's 67. This is really one of those diseases where we only typically see it in men who are considered older, above 40 years old. If you're between the ages of 40 and 54 years old, if you're considered to have what we call an average risk for prostate cancer, and you're expected to live at least 10 more years, they're not going to recommend screening, but you can use shared decision making to discuss whether screening is right for you with your doctor. And then if you're between the ages of 40 and 54 years old and you're considered to have a higher than average risk of developing prostate cancer, this is where they actually recommend you undergo screening using shared decision making. So anyone that we deem high risk is usually someone who has a family history of prostate cancer, meaning they have, one or more first degree relatives, like a father or a brother that was diagnosed at some point with prostate cancer. And then we also consider African American men high risk for prostate cancer because of those disparities that we see in incidence and mortality. Otherwise, they're really not going to recommend prostate cancer screening until around the age of 55. So most men between 55 and 69 years old, and then also healthy men over the age of 70 are going to be encouraged and recommended to discuss prostate cancer screening with their doctor, use that shared decision-making process to discuss whether screening is right for them. And so this conversation could include discussing the patient's individual risk. What is my risk of developing prostate cancer? Discussing the risks of prostate cancer screening and whether the risks outweigh the benefits. And then men who do not have any symptoms of prostate cancer and have a less than 10 to 15-year life expectancy, they're actually not going to be typically offered screening because they're not likely to benefit from the early detection of low risk prostate cancer. And this is where I go back to that active surveillance treatment option. Since prostate cancer is such a slow growing cancer, there really isn't enough time for the disease to become life threatening in men who are considered to have a limited lifespan. And so typically in those instances, they'll recommend that active surveillance treatment, closely monitoring the progression of the disease, because sometimes that person is more likely to be harmed from, let's say, radiation or chemotherapy or going under anesthesia. Those are more risky for that patient than actually leaving the very low risk prostate cancer in the body and just monitoring the progression of the disease. Just to summarize, we know prostate cancer is really one of the more common types of cancers that affect, many men of all races. And when we discover prostate cancer early, we know it's potentially curable. So prostate cancer screening, we do that with PSA blood tests, with digital rectal exams. It's currently the best way we have to detect prostate cancer early, despite those controversies and instances of false positives and false negatives. We do know that many prostate cancers are deemed low risk. So they're not going to require immediate treatment, but rather active surveillance because it can take several years for the cancer to start to progress to an advanced stage and actually cause a threat to individual life. But with all this in mind, if there's one message I'd like for you all to take home with you, it's that all men should at the very least discuss getting screened for prostate cancer with their doctor, especially if there's that history of prostate cancer in the family or if they're older than 54 years old. And then these are just some resources for prostate cancer. These should be uploaded with the slide deck on Mighty Network, so you guys can go in there and take a look at all these different online resources just to learn a little bit more about prostate cancer and some of the things that organizations across the nation are doing to raise awareness about prostate cancer, including Jazz for Prostate Cancer Awareness, which I believe we'll be talking about next.
I'm going to share the poll now, and then we can do the answers for that.
Great. Yeah. So we'll do the post test now. This again are the same exact questions you guys had in the beginning of the presentation. Once they're up on your screen, just take a moment to answer those. And then is the answer slide the next one? Are we going to go over the answers as well? All right, cool. So then I'll give you guys a couple seconds for that, and then we'll go over the answers to the poll questions. Some of your answers might have changed. Some may have stayed the same. It all depends on what you answered beforehand and if there's anything that you learned during the presentation we just had. Mm. All right, so I think the poll results should be up. So I see for question one, we had about 92% of you answered true. So for question one, New Jersey has one of the highest incidence rates of prostate cancer in the country. This is absolutely true. We saw that we actually have the second highest incidence rate of prostate cancer. The only state with a higher rate was Connecticut. But again, we looked at those mortality rates as well and saw that although we have a very high incidence rate of prostate cancer, we do have one of the lowest mortality rates, which is a testament to the work being done to detect prostate cancer at an early stage and prevent late stage progression, therefore preventing, instances where people are dying from the disease. For question two, I see 100% of you chose true. African Americans are more likely to die from prostate cancer, and that is true. We looked at how African American men are about 1.7 times more likely to be diagnosed with prostate cancer and 2.1 times more likely to die from the disease compared to white men. We talked about why that may be, looking at racial biases that exist in preventative care, and also looking at some of the statistics regarding incidence and mortality amongst different races. And then for question three, smoking increases prostate cancer risk. 100% of you chose true, and that is absolutely true. We do know that smoking cigarettes and using tobacco products not only increases your risk for prostate cancer, but other forms of cancer as well. Thank you guys. I appreciate you listening to me. I think we're going to transition into the case study with Ralph. And so I will pass the floor to him. Take it away.
Hi, everyone. So for today's case study, we're going to do something a little different. We're going to do kind of like a Q&A style. So I prepared 5 questions to ask Ralph. But at the end, if you have questions, we'll do an unmute or you can type in the chat to ask him yourself. Ralph actually did a echo with us back a few months ago. I can't remember exactly when, but we did go over a lot of like his diagnosis. It was more of like an introduction. So if you want to see that, please go to the Mighty Networks. This portion will be a little bit more about him, his story, becoming a founder, what's the future for Jazz or Prostate. So, Ralph, do you want to introduce yourself a little? I know you
Yes.
also want to
Thank-
share your screen, so we can figure out when to do that. You can tell me when, and I can just.
Yeah, well, first of all, thank you, Sarah, and thank you, Ryan. I think you did an incredible job of explaining um, prostate cancer, the risk factors, and what it is in general. Um, I wanted to add, I'm a cancer conqueror. I don't call myself a survivor. I call myself a conqueror because not only did I have conquered cancer, prostate cancer, but I share my story to help save lives, and that's what I call a conqueror. And hopefully, uh, Jazz for Prostate Cancer Awareness is helping to get men uh, aware, and then the ones that are going through, when they get to the other side, they become also conquer is to share the story, and that's just how we get awareness really out there to have this disease not be so impactful, especially in fatalities. Um, but yeah, Sarah, I what I have, if you can, if I can share my screen, I want to share with everyone a commercial that Rutgers had, and Rutgers with the joint of Robert Wood Johnson Hospital, they had put out in 2016 and 17. I'll just quickly show that, and we can get into the questions that you have for me. I will share. Uh, can you see my screen?
Yeah, we can see your screen.
Okay, it's really short. That was considered cancerous. I came in for a routine examination, which I usually do because I have a good relationship with my doctors. And about a week later, they told me that they saw some tumors in my prostate that was considered cancerous. And I went on the internet and Googled robotic surgery, and I tried to find who was really, really good at it. And I ended up finding my doctor here, which was Dr. Isaac Kim. I stayed very close to my brother, who actually, I will say, saved my life because unfortunately, he discovered his cancer a little bit too late. It took it took him. He was actually a very gifted and notable musician, and I started jazz for prostate cancer awareness in honor of my brother, who was a jazz trombonist. Okay, so I
Thank
started.
you so much for sharing that. That was beautiful.
Thank you. Let me stop sharing and get back to you. So, how would you like to begin?
Okay, I could just read the first question out loud and then we'll just let you answer.
Sure.
All right. Can you share how your personal experience with prostate cancer alongside your brother's shaped your perspective on early detection and men's health advocacy?
Yes, I can share personal experience. Again, I didn't know anything about prostate cancer until my brother was diagnosed with prostate cancer at the very late stage. And that's when we needed to understand. And of course, his doctor recommended that uh, myself and my other two brothers get get checked, and we was diagnosed with prostate cancer. But from a local perspective, it did not spread like my brother had spread. So that allowed me to understand um, a lot about healthcare, a lot about the responsibility of healthcare and early detection and knowing numbers. Um, and really just becoming an advocate because I knew there was men uh, that knew my brother, who was the same age as my brother, who had passed away at 61. Um, I was not informed of what was going on with their bodies or could be going on with their bodies, and they needed to know a little bit more. And it's because of the fact that a lot of the musicians, a lot of people in that community didn't have the strongest health care
Mm,
uh, insurance.
yeah.
Um, some believe they did, um, and they didn't ask the right questions, or their doctors weren't informing them because of who they were as a doctor. So there was a lot of things that I started to learn, and it became something that strengthened my advocacy for prostate cancer awareness.
Thank you for answering that. So this is a similar question about advocacy, but how has your journey from patient to advocate shaped the way you communicate about prostate cancer with other men, especially those who are hesitant to get screened?
Well, as a patient, I was blessed with a great mentor in the doctor that was my um, surgeon. He's the one who removed my prostate. He was the one that was very interested in understanding, um, me becoming an advocate. Dr. Isaac Kim really shaped my way of understanding what I can become. Um, as I became patients for him, I was 46 years old. Ryan talked about the age that you need to be concerned or start being concerned. Um, I was in that early stage of between 40 and 54, I believe he had on the screen, and I thought how young I was at 46 being diagnosed with prostate cancer and not knowing what that was about because I had no symptoms. But because of my brother, who being related to my brother, and he had prostate cancer detected when he was in his 50s. And but it was too late. It was now he had to be treated with chemotherapy and radiation and all types of experimental drugs. So as I'm going through, it started to make me understand that I got to communicate this. I gotta understand. Men have to understand how we need to get early screening because early screening will save you. Early screening will understand what you have to do in order to not die from this quiet disease.
I completely agree. So this is a question about JAS for prostate cancer. How does JAS for prostate cancer engage communities, especially underserved populations, in prostate cancer awareness and screening efforts?
Good, well, I'll say good question. Man, I have lots of partnering. I have to first give it to Rutgers by the way of my doctor, Dr. Isaac Kim. We became friends. We're still friends to this day. He's my mentor. He's a he's very talented as a surgeon in this area of prostate cancer, and he really shared a lot with me. So he poured a lot, gave me a lot of insight of why is needed awareness, um, and with the help uh, of jazz, starting the conversation, getting men involved with a conversation like prostate cancer, having music, really good music, uh, to um, to to shape the atmosphere, to bring it where everybody wants to listen in that atmosphere. Good music brings that. Um, Jazz, which is an art form, brings that because you're looking at really talented musicians, not musicians that's just playing because they want to shake your booty or whatever. They want to, let you see what they have studied, and you're watching them communicate with other studied musicians, and that music becomes really good to hear, and you're engaged. Well, that environment allowed me uh, to engage conversations about prostate cancer and awareness and risk factors. And it was a vision that was kind of unique because who wants to talk about cancer at a jazz concert? But it was more of a wow, there's things that I need to be aware of, and I could do this while I'm enjoying good music, good food, with good company. Um, And now I've gotten that information. I'm going to seek out screening. I'm going to talk to my doctor. I'm going to ask these questions. I believe uh, when I started this foundation, it was like I said, right after my brother's death in 2009. So by 2010, um, I've been mentored, I've been studied, I've became my own conqueror, um, um, by my surgery. And my doctor stayed with me, told me all the stats and all the information that Ryan shared earlier, um, which was a great, something that I, revisit. I was glad that he did such a good job of explaining um, prostate cancer. I got that privately, and now I'm here to share it using jazz, doing concerts. And my brother who played um, all over the world as far as a trombone player, and he was on famous records. So his friends have such an alliance for him and such a respect for who he was. They said, Ralph, I will do whatever you would like for us to do. If you call on me, I would love to be a part of what you're doing this in this advocacy. And I'm talking about people like um, Najee and Marcus Miller and Tom Brown and all the other friends that he had and he played because of his talent and his trombone ability. Um, this what made Jazz for Prostate Cancer Awareness effective and impactful.
I'm so lucky that I get to witness the amazing work that you guys do. I know even with our like cancer prevention pantries, it's just so nice having you guys around and it helps talk about like such hard topics like cancer. All right, move on to the next question. Can you describe some of the most impactful events or collaborations Jazz for PCA has led and what outcomes that you've seen from those efforts?
Wow. Okay. I'll be happy to share that. I'm very proud of, again, the partnering that I receive from folks like Screen and Jay and Rutgers and all the things that I am able to do. I've been elected to be co-chair of of Rutgers Community Action Board, and that's a gathering of community leaders um, that come together, frequently and talk about and learn about cancer prevention and some of the latest that we're doing for cancer. Um, um, I have joined lots of other studies, a study group under Rutgers, including what is called CAN-CAN, and that's the study of cancer cachexia, where they're studying how cancer, whatever biomarker can be found to understand how cancer can be found in a patient way before they they knew that they had cancer. So they're trying to find things in that regards, and I'm a part of that team, and that is impactful. It's impactful to take someone like myself and other advocates to join research teams so that we can stay focused on the community that we're trying to help. Without a community person that's bridging that information, we're just sometimes we can miss the mark. I think Rutgers seen that possibility and said, let's uh, let's bring in let's strengthen our team. Let's bring more people that cares, that has empathy in this area of the community, healthcare, and all the things that uh, that we need to do to fight for the community, and especially at these times where healthcare is being challenged to be taken away. Um, we need healthcare. It's a right. It's not a privilege. It's something that we all deserve to have. And so that's what Jazz for Prostate Cancer Awareness is doing in those type of collaborations. Um, Sarah just mentioned she had witnessed what we have. We have an annual event called Jazz for Dads, and it's simply celebrating fatherhood and mentors with jazz on Father's Day, and we use that time to talk about prostate cancer and wellness and how we can continue to stay, in that fight from making sure that everybody knows what they need to do and staying healthy and getting the right information from the rightful people. Um, uh, I can go on because we've been doing this for 14 years. Next year will be our 15th year uh, running advocacy through Jazz for Prostate Cancer Awareness.
I'm so glad you mentioned that the 15-year anniversary is coming up because that kind of leads into my next question. So, looking ahead, what are your goals for Jasper PCA and how do you envision expanding its reach or deepening its impact on men's health education?
Well, the goals for Jazz for Prostate Cancer Awareness is for what it's been doing. It's been really promoting good music, not for the purpose of that, but the purpose uh, of having folks becoming a great partner in this platform for advocacy, for sharing information, for caring, for yeah, for sharing. And so the goals that we have for prostate cancer awareness, well, we want to get into more uh, of areas that we can do this type of awareness, including jazz festivals. We have been talking to jazz festivals now for the last year and a half. Montclair Jazz Fest likes who we are, and they would like for us to have a table, maybe even bring a jazz group to that. That allows us to talk to their audience, their, millions, thousands and thousands of people that visit jazz concerts. And now we have jazz pushing a purpose, pushing a cause, uh, being very impactful in the community while we are, showcasing great talent. Now it doesn't have to just be great talent and just highlighting who they are. We're highlighting what this platform and jazz can do to help save lives. So that's one of the things to do is to get into more of jazz festivals around the country and perhaps around the world.
Well, you're definitely making that happen because you have some exciting news, right? In August, Ralph is going to be doing a talk in London. So you're definitely making that happen.
What's exciting about that more than me going to London is the partnering of being a part of a team that are researching and doing things to prevent and to detect cancer and doing something about it. We've been studying cancer prevention or cancer research for years. I think the beginning of cancer research is in uh, 1913, but we haven't cured cancer. So they say. Um, but it but being in partnership. Um, and now people are coming together, and now I'm going to London to represent uh, what I have been saying and doing and being supported by Rutgers and their research team. Um, they want me to say a lot about what about advocacy, about the importance of what they're doing to put more purpose to why people are doing research. Sometimes you can get lost in research. You can just research just because you're talented and intelligent and you studied. But now you have to put a purpose to this, and you have to come with a cure and be a little bit more urgent, you know, because there's people that's waiting. If you have an answer, they want that answer. So I think that's what I'm excited about going to London or going to anywhere that allows me to remind the team of our purpose of what we're doing and why we're doing it.
Thank you so much, Ralph. Thank you for doing this for us. Thank you, Ryan, as well. If anybody has any questions that they would like to ask, I saw Lisa asked Ralph, like, where do you have your events? But I saw Ryan gave the website and you have your calendar up there that you
Yes.
upload. Okay.
Yep.
I'll
Ralph,
also post your information on the Mighty Networks.
Ralph, you also have a newsletter, correct?
Yeah, it's not consistent. I have to say I do lack resources in helping me getting newsletters until. But now I've been talking with my vice chair, Wally Jackson. He comes up with great ideas, and he says, chat GPT is will be great to help get that going, and get a newsletter consistently out because we're doing so much. We do need to just, just to share the information.
All right, and if you come up with any questions that you want to ask Ralph or Ryan, you can ask them on our Mighty Networks. I'm going to zoom through the next few slides because I know we're a little over time. NJC, so in our state, we have the New Jersey Cancer Education and Early Detection Program. They provide free screenings to those that are unemployed, underinsured, uninsured, or face barriers to getting the cancer screenings that they need. They provide screenings for all 21 counties. I know they do breast, prostate, cervical, and colorectal cancer. I put the link and the phone number in the chat as well. Thank you for attending today's session. I put the link for the eval. If you could just so kindly do this and let us know how we did. Our Mighty Networks link is also on there, so you can also upload whatever you would like if you have an upcoming event, if you have a question, if you have something that you would like to share with our entire network, please feel free. And everything from today will be posted. And then join us next month for a session on breast cancer. Thank you all so much. And the references will also be posted. Thank you, everyone. Thank you for attending.
Thank you, everyone. Enjoy the rest of your week.
Thank you.